Excellent. Well, thanks very much for the attendees who are here. That's brilliant. Hopefully we might get some more as we start to talk. My name's Doniert Macfarlane, and we're going to be talking about telemedicine today and all aspects of it. So let's get started. I'm just going to tell you a little bit about myself to start off with. My background is in orthopedics, and also I occasionally do the odd shift in emergency medicine just to get me out of the house. And also am the founder of Remote Medical Support. During the lifetime of the company, we've worked on a number of different projects. We work with a number of different clients. And those clients have asked us to do lots of different things, including complex repatriations and complex fitness to fly assessments. And we have a whole range of clients, which include anywhere from Bear Grylls to the Foreign and Commonwealth Office, BBC, travel management companies, and so on. And the reason for explaining that is because we'll be drawing on those experiences of our clients when it comes to our case examples that we give later on. So that's just a brief overview. So the topics that we'll cover, we're going to talk about what exactly telemedicine is, the definition of it, the impact of falling in for the business traveller, the fact that health is not a binary issue, it's not you're ill, you're not ill, and also about how to make health decisions, which is important for travel managers, important for travel bookers, making sure that that's done by the right people. Also, we're going to be talking about technology and resource, how to set up the ideal telemedicine system in general, at the state of the industry. We're going to look at the uses of telemedicine within business travel, and we're going to go through some case studies and have some time for some questions as well later on. First thing I'd like you to do is just to clear your mind. Okay, you probably have busy days today, and the first thing I'd like you to do is just do an exercise whereby you just close your eyes for a second, literally close your eyes. Sit back, relax, and just try and clear your mind of anything you've ever heard about travel health issues. Travel insurance, just clear your mind completely of anything like that. The second thing I'd like you to do is to visualize, without having to tell me because I'm off duty, any health problems that you've had, okay, in your lifetime. Can you, at the moment, tell me how many times in your entire lifetime you have ever felt ill? Okay? How many times out of those times have you taken a day off work in your adult lifetime? Out of those times, can you remember how many times you've ever visited a pharmacy? Maybe not, because there have been too many times. But how many times in your lifetime have you seen your GP? And how many times in your lifetime have you been to hospital, had an operation, or been to intensive care unit? You'll probably be able to remember the last 2 or 3 because they're much more significant events, but they're also much more rare. So that's the first thing to visualize. The second thing I'd like you to visualize is also your concept of business travel and what that means. In other words, what it means to be a business traveller. What sort of ground transportation does that mean to you? What sort of business lounge does that conjure up to you? What type of class of plane ticket or train ticket does that envisage? And finally, what type of hotel accommodation would that mean to you when you're thinking about business travel? Because I'll come back to that later on when I'm describing what I call the bubble of business travel. And finally, the last thing I'd like you to think about, eyes open or closed, is what would disruption of a business journey mean to your business, and what would it mean to the business traveller? Okay, and what we're going to do is we're going to incorporate all of those points later on and see how telemedicine can help with all aspects of it. Thank you. So what is telemedicine? Literally tele and medicine, remote medicine, and that's the actual definition if you're to look it up. Diagnosis and treatment of patients using telecommunications technology. So that can mean anything. It can mean a telephone, it can mean online, it can mean emails, anything at all. And what are the limitations of telemedicine? Well, they're multiple, and I'll be the first to admit there are multiple limitations to telemedicine. If you have someone who comes to you who's got abdominal pain, you really need to be in a position where you can examine that person, and there's never, no matter how good the technology gets, going to be a time when telemedicine will replace a face-to-face examination. But having said that, we're now in the golden age of telemedicine. And why are we in the golden age of telemedicine? So you have demand on one side and you have technology on the other, and they are coming together like this right now. And lots of companies are thinking about it right now. Lots and lots of VCs are thinking about this right now, and it's all really coming together. On the demand side, in the developed world, you have governments thinking about how to best use telemedicine to cope with increasing demand of an aging population. So we're seeing more and more consultations in terms of specialities like dermatology. We're seeing the expansion of telephone consultations with GPs. When we first started in 2005, that was deemed as complete heresy. Now it's a regular part of the NHS practice. In developing countries, governments are seeing this as a key way in which they can get the expertise of their few well-trained doctors who might have been trained overseas to a wider population who might be less mobile and less able to travel. So everyone globally is looking at this issue. From a tech point of view, you're quite right, everything is coming together quite nicely. There are three elements when it comes to technology. There's infrastructure, so you're thinking about 4G connections, you're thinking about broadband connections, you're thinking about better telecommunications all around the world. You're also thinking about software and user interfaces, which are becoming more groovy, more interactive, more user-friendly all the time. And finally, you're also thinking about different aspects of how that technology can be incorporated easily in terms of hardware. So we all are now carrying smartphones. So when I was a more junior doctor, I'm a consultant A&E doctor at the moment. When I was a baby doctor, if you like, working on a plastic surgery firm in about 2002, one of my consultants came bounding in one day because he had a digital camera, okay, which meant that he could now send pictures of skin lesions to his colleagues by email. Whoa, fantastic. And do you know what? It had a massive 1.3 megapixel definition. And he was so excited about it. He was showing, and it was massive. This thing was enormous. And he was absolutely gutted because the next week, one of his consultant colleagues came in and he had a 2 megapixel camera, which was also equally massive. And that was in 2003. And now each of us are within arm's distance of a smartphone. You have to be almost living in a cave now not to have a smartphone. You have to voluntarily not want one now in the UK to not have a smartphone. And so all of those cameras that we have in our smartphones will have 8 megapixel cameras, 10, 12, 14. My one has a 23 megapixel camera, not showing off, but it does, okay? And so we've all got this technology and it's all available and it's all very much affordable. Smartphones from 40 to 60 pounds. So it's a golden age for telemedicine. We were thinking about what the visualization of a business travel trip meant to all of us. And we were thinking about probably, well, we'll come on to the things, chauffeur-driven cars, business lounges, and first or premier class travel. Now, for the leisure traveller, in terms of curtailment because of illness, it's a very different prospect. If we are going on leisure travel, the primary objective of leisure travel might be to do absolutely nothing. You might be bragging when you come back from holiday and say, do you know what, I went on holiday for 2 weeks and I did absolutely nothing, okay? And that might be deemed absolutely fantastic. Or the other primary objective would be to actually see something. I want to go and see Machu Picchu, or I want to go to a souk. I want to actively engage with something locally in those countries where I'm visiting in. And that's a perspective of a leisure traveller, okay? So that's a winter market that someone might want to go and see. So if they become ill, that has an impact on their personal well-being, and that might lead to curtailment. And the decision to curtail that travel might become a bit easier because there's nothing really else that they want to do in that location. They might just want to get home. Now, if we're thinking about the business traveller, that's a completely different prospect. When I asked you to visualize the modes of transport of a business traveller, what I was describing and what you might have been thinking about is the concept that I have of the business travel bubble. So we might be thinking about this: ground transportation, business class travel, or first class travel. Why do business travellers travel in that class of travel? So you'll have people who are making multiple business trips and you want them to arrive there as fresh as possible, ready to do business. Some of it might be an exercise in retaining and recruiting the best staff, so you want them to travel, stay in the best hotels. But the primary reason for keeping people in this bubble is so that they arrive fresh and ready to do business, and also to make sure that they're incredibly productive during the downtime whilst they're on the road. So that's the use of the business lounge with Wi-Fi connections and a quiet space where they can do work. There might also be specific safety requirements in certain locations whereby you'd want them to be contained within that bubble. So I put it to you that when you are ill, that has a personal impact on the well-being of that traveller, but also means that you have unplanned travel to places outside that bubble, unknown destinations, unknown travel. It might require late booking or changing flights at the very last minute. And finally, it has an impact on business because you are sending those individuals overseas. You're paying, the top dollar for their flights and for their accommodation. Why? They are there to do a job. Okay, so any curtailment has an impact not only on them, on the bubble, but also on the disruption of the business. And I'll come back to what this means for telemedicine in a minute. I'll tie it all together. The question we really should be asking is what type of illness and how severe is that illness? Because health is not binary. It's not ones and zeros. It's not the traditional thought process of you get ill and you go home. Health has a spectrum, and the spectrum of illness has to do with when you become ill, when you're most likely to become the worst and suffer the worst part of that illness, and in general, what type of illnesses you suffer from. So we're going to go through each of those. So if you think about 200 illnesses, the top 200 illnesses that might affect a human being, they're all listed there. And then you can pretty much draw a pie graph without going into the specific illnesses of mild, moderate and severe. So that's when you're thinking back to your own self about how many times you've actually felt unwell, how many times you've taken a day off from work, been to see your GP or been to see a pharmacist. That would follow that. How many times you've been to intensive care or had an operation. You can count them on one hand, I'm sure. And just back on that, a lot of these travellers will be carrying these diseases with them. That's an important factor. Yes, you can add in travel medicine and other things that will make these problems more of a problem. But a lot of them will be travelling, particularly in the over 50 population of business travellers. We, in one sector of our business, look after expedition travellers. And last year, we fielded 3,000 calls from expedition travellers. Can anyone in the audience think how many of those calls were about, for example, life-threatening malaria? Any ideas? Yeah, not many? I mean, it's about 2 or 3. You're right, it's not many at all. How many out of 3,000 were to do with travellers' diarrhea? 2,000, literally 60%. 2,000 to do with travellers' diarrhea. So it very much follows this picture. Now, no one's going to think about calling in an air ambulance if you've got travellers' diarrhea. Okay? But that's just something to think about. We'll come back to that. And then there's a spectrum of illness with time. Now, this is a graph of an illness, and it doesn't matter what this illness is. This might be just having the snuffles here, to a full-blown flu, and it might even progress to pneumonia. At the very peak of the severity of that illness, there may be a line here where you might need medical intervention, and that medical intervention might need antibiotics, or it might need a clinic attendance, or even hospitalization. Then, God willing, everything will get better and it will return to a subclinical level of disease. Where you are on this scale, in terms of the chronicity of that disease, has an impact. If you are in country and due to travel back within 1 day, you may choose to undertake your medical intervention back in the UK. If you are here and you have a 2-week business trip, you will need to find a medical intervention somewhere locally. And then you have a severity of illnesses. So if someone says to you, I've got kidney disease, medically you'll be saying, well, what stage kidney disease? Is it stage 1 all the way through to stage 4? I have arthritis of my knee. Is it mild, moderate or severe? I have asthma. Is it mild asthma or is it life-threatening brittle asthma? So there's a severity of any disease. So it's not really just ones and zeros, I'm ill. I'm not ill. I'm fit for travel. I'm not fit for travel. So, illustrating that with some real examples of travel medicine issues, you can just have a look through that slide at your leisure, and then I'll come to the point I'm making. The point I'm making is this, is that the decision of what to do with a business traveller becomes easier the more ill they are. The decision of what to do with a business traveller becomes easier the more ill they are. So if you're involved in a road traffic accident and you've fallen down a ravine in a car and you're hanging upside down by your seatbelt with a broken leg, you're probably thinking to yourself, when I get out of this, I'd like to go home. Okay? But I put it to you that the incidence of those severe things happening is much less frequent than these. And whilst telemedicine can't do interventions, it can't set your legs straight, the majority of these and the more frequent questions and the more difficult questions, these are where telemedicine has its greatest use. And these are where telemedicine should be used. So, can key personnel stay in country with the right health advice? Well, the figures suggest so. Using an example of 14,000 business travellers from the UK who are based overseas or travelling overseas, these are the figures from a genuine study. There were 35,000 calls regarding their health. That's about 2 per traveller per annum. There are about 140,000 online exchanges, about 10 emails per traveller. There are about 150 medical journeys to local clinics. So that's about 1 in 100 went to medical clinics. How many repatriations? Only 15. Okay. So, the new approach to business travel is this. Not that you're ill or you're not ill, or you get ill or you go home, but you can stay in country if the condition is mild. You can wait till you get home if you have a travel which is going to take place either before or after the maximum spectrum or severity of the illness. Or you're fit for travel if you can have the best support through the best technology and the best advice. So telemedicine has a huge role to play within this approach, which is that you keep your key personnel in country wherever it's appropriate. Okay? You spend a lot of money getting them there, they've got a lot of work to do, you try and keep them there wherever appropriate, and you use this technology to keep them where they are. And it's not ones and zeros, they get ill, they get home, you can stay in country if. And a lot of the fitness to fly assessments we did on behalf of the Home Office, we just went with a completely different approach. It's not they're fit to fly, they're not fit to fly. They're fit to fly if they have an accompanying paramedic with them with a drip ready to do. They're fit to fly if the aeroplane goes at unpressurized altitudes with a pneumothorax. All of these different things. It can be much more complex than that, much less binary than it has been in the past.